friends, I am Dr. Reena Bansa from Nabha, Punjab. So today I would be talking about the follicular fluid mechanics and pressures. So just imagine this is a 20 mm of follicle having almost 3.5 ml of the fluid inside it. So because of this fluid inside this, it will have some intrafollicular pressure that is around to the tune of 6 millimeter of mercury. So like at the time of ovum pickup, we have to put some mechanical pressure with the help of the needle, and that is going to be a positive pressure to make it rupture. So how do we enter this follicle? We have to enter perpendicularly and with a single nick. We should not be going tangentially to the follicle. So it is going to tear the follicle, and patient is going to have more hemorrhage inside. And as there are so many number of follicles in both the ovaries, so if we would be going tangentially in all the follicles or few of the follicles, so patient is going to bleed much more. So we should always try that we enter the follicle always in the perpendicular direction. So once we give a mechanical pressure, it should be 10 times almost to the intrafollicular pressure, which is 6 millimeters of mercury. So with the needle, the pressure is going to be roughly 60 millimeters of mercury. That is going to be positive pressure. So once we just puncture it, we should do it with a zap. We should not like go tangentially, or we should not take a lot of time. And our foot should be on the pedal, and the negative suction should be on immediately. And once we just break it, and see like what mistake I made right now. So we have to stabilize this follicle. We should make a funnel, and our foot pedal should be ready to create a negative pressure of 110 millimeters of mercury. So when we just enter the follicle, it is going to rupture like this, and our negative suction should be on. That's it. Thank you so much. Yeah.
How do we make sure
Name, where do you come from?
So I'm Lata Chitravedla from Pondicherry. I want to know, how do we know that the follicles don't move and we should stabilize it?
We can use our abdominal hand and with the vaginal probe, and we can just stabilize the ovary. And once we are entering the follicle with the help of the needle, and we would be handling the probe with our left hand, because I am a right-handed person, so I would be holding the OPU needle in my right hand. Once we have fixed, and we can ask our assistant to stabilize the ovary from the abdominal side. And once we are entering the follicle with the help of the needle, we should not move our TVS probe, which is going to have a shearing effect on the ovary.
No, my problem is when you're moving from one follicle to the other. Sometimes, as you said, it may go into the membranes like tangentially. How do we avoid that?
We have to bring the needle in the center of the follicle, so that we enter perpendicularly into the follicle.
So once you enter the follicle, you keep the ovary 75% in view. We have a vault. Keeps
yes.
You have to keep 75% of ovary in view at one point of time. And then this means that 75%, you can have 15 here, and rest all 70 should be in the vault white line. And then when you enter the vault, try to enter the vault in the middle of the vault. You know the white line is the vault? Enter the middle of the vault and try to go to the middle follicle of the ovary focused. You can see 3-4 follicles lined here. So go to the follicle which is in the middle of the ovary, which has been focused. Enter that follicle in the middle by tenting. Some people just go poke inside. Don't poke. Gently screw and make a tent and go inside. That's what funneling. Then keep the needle inside middle of the follicle. Now this needle has got visibility for around 4 to 5 centimeters. Not more than that. They will go blind. The follicle, the beauty of ovary is that it's got multiple follicles which are encapsulated by the ovarian cortex. The ovarian cortex is something like, in case you blow the balloon, leave it, the balloon will collapse back. So they are trying to compress the follicles. So once you take one follicle is 2 centimeter, right? 2 centimeter. There are 2 centimeter here, 2 here, and 2 here. Think around 2 and 2. The ovary is this big, one view. right? Simple logic. It has to be so big because we got 2, 2 and 2. So
Six
it becomes
centimeters.
big. And visibility is only 3 to 4 centimeters. There may be 4 or 5 follicles which are lying here. So you take one follicle. As you take aspirate, this will become totally compressed, and then over this you will have
That
now
one will
4
enlarge.
centimeters.
Yes.
Then fall down. So beauty is you don't force into an ovary. Let the ovarian cortex bring the follicle towards you. That's the beauty of it. Don't apply pressure and go inside. Let the cortex do the work. Na? So use cortex as your friend. And cortex boundaries are seen as a white line. So once you go inside, it will collapse. 2 centimeters will come towards you. It will now become 4 centimeters. So take this, and now if you find you have gone in around 3-4 centimeters and taken 2-3 follicles, then what will happen? You have one follicle here, and that's what follicles are lying in this corner.